Hey guys, this is Sydney Standa and I'm going to talk to you today about Leishmaniasis. So what is it? It is a disease caused by the Leishmania protist, and there are three forms: the visceral, cutaneous, and the mucosal forms. It's spread by the phlebotomite sandfly and is considered a neglected tropical disease, which is a disease that, combined with all of the other neglected tropical diseases, infect about 1 billion people per year and are generally eradicated in developed countries. So the protist itself is obligate intracellular, but that's actually kind of misleading because it's only intracellular when it is within the host. And when it's in the host, it's called an amastigote, but when it's in the sandfly, it's actually extracellular and is called a promastigote. So there are 30 species that infect mammals, 21 of which infect people. So there are 20 species that cause the cutaneous form, and so examples of this are the L. mexicana, L. tropica, and L. major. The visceral form is caused by L. donovani, which has two kind of subspecies, which are L. donovani and L. infantum, or as it's also called as L. chagasi. The mucosal form is caused by the Vienna subgenus of the genus Leishmania, and that subgenus also causes cutaneous leishmaniasis. So morphologically, you can't really tell the different species apart because they're all so similar. They only differ based off of where they are in the world, and the only way you can tell them apart is molecularly or through monoclonal antigens. At the bottom here you can see an example of what a sandfly looks like, and also what the protist looks like when it's in the promastigote form. Okay, now we're going to talk about the signs and symptoms. So we'll start with the cutaneous form. It's generally characterized by skin lesions on the skin, which can either be open or closed. They generally start as small papules, then progress to nodular plaques, and then to cratered lesions, which are ulcers. Generally, these are painless unless they are on a joint or aren't properly cared for and are infected by bacteria or another microorganism which causes an infection. You can generally see symptoms from this 2 to 3 months after being infected, but you can also see symptoms as early as 2 weeks or as late as years after being initially infected. The scars themselves generally heal on their own, unless they're severe, then they actually do need to be treated. The lesions can cause scarring though if not treated very well. Some other signs and symptoms are satellite lesions and also infection of the lymphatic system. So next is the mucosal form, which is actually caused by the spread of the protists from the cutaneous form to the mucous membranes of the nose and mouth. Generally, you'll see this manifest itself like years after being infected by the cutaneous protist and after those lesions have gone away and healed. So it's really after you think that you're completely clean from the disease, it shows up again. If it infects the nose, and it's not properly treated, then it can end up causing a perforated septum, and if you get it into your mouth, it can cause palate dysfunction, disfigurement, and even trouble speaking and swallowing. Here you can see someone who has the mucosal form in their mouth, and you can see the lesions at the back of the throat. So next is the visceral form, which is considered one of the most dangerous forms. It's generally characterized by an infection of the spleen, liver, and or bone marrow. You can also see fever, weight loss, swelling of the spleen and liver, and also anemia, leukopenia, and thrombocytopenia, which respectively are decreases in counts of the red blood cells, white blood cells, and platelets. Sometimes you can see it appear just weeks or months after being infected, but there's also a latent form that really only appears if you become immunocompromised, either from old age or by getting another infection such as HIV, which causes you to become immunocompromised. So now I'm going to talk about epidemiology. So the protist actually exists everywhere in the world except for Australia and Antarctica. So you can find it, basically everywhere, but risks of getting it in developed countries is lower. It's actually now just found, the disease is found in 90 countries, which are mostly in the tropics, subtropics, and parts of southern Europe. There have been some cases in the past in Texas and Oklahoma, and those were the cutaneous form, so the lesser form that doesn't need as much medical attention. The cutaneous cases, new cases of it, range from 70,000 to 1.2 million per year, and the visceral form is 200,000 to 400,000 per year. Of these two forms, there are about 20,000 to 30,000 deaths caused by Leishmaniasis. Here I have a map showing the visceral form throughout the world, and as you can see, it's mostly just in the tropics and tropical areas of the world. Here I have the cutaneous and mucosal forms, showing where they mostly are in the New World or in the Western Hemisphere. The mucosal form is actually only found in Central Latin America and South America. Then also here's the L. tropica and L. ethiopica forms, found in, looks like, around the Middle East and parts of Africa. Then also down here is the L major form which is once more Middle East, Northern Africa, and then just a few parts of sub-Saharan Africa. Okay, so now I'm going to talk about transmission. So as I said before, the Leishmania protist is transferred by phlebotomist sandflies, which means that it is a vector-borne disease. These sandflies are most active from dusk to dawn, so that's during the night when people are sleeping and aren't really trying to protect themselves against bug bites. The visceral form is actually mostly transmitted by the female phlebotomist sandflies, and can also be transmitted congenitally, which is from mother to child during childbirth, and parenterally, so through blood transfusions and needle sticks. Different species of the Leishmania protist are actually transmitted by different species of the fly. There are about 30 species of the phlebotomist sandfly that actually transmit the Leishmania protist out of about 300 species of phlebotomist sandfly. So it really just depends on where the flies and the protists are in the world, how to base which flies carry which species of the Leishmania protist. So next I have a view of the cycle of transmission of the Leishmania protist. So it starts when the sandfly goes and bites a human host, and the Leishmania protist, which is currently in the promastigote form, enters into the human. When it enters in, it is then phagocytized by a macrophage or other phagocytic cell, and once inside, it transforms into the emastigote form from the promastigote form, and then multiplies and spreads throughout the body and then causes the illness. Then, after spreading throughout the body, the person will be bit by another sandfly, which then takes up a cell that has the emastigote form of the Leishmania protist. Once inside the gut, the Leishmania protist will then, come out of the cell, transfer into its promastigote stage, and then multiply and travel up into the proboscis of the sandfly so that it can then be injected into another human host when that fly bites another person. Okay, so now we're going to be talking about diagnosis and treatment. So when it comes to diagnosing Leishmaniasis, we can do it either through molecular methods or simply observing infected tissue under a light microscope. So as you can see in the picture here, we have a macrophage that contains visceral Leishmaniasis that is being viewed under a light microscope. So when it comes to treating it, you have to do very individualized treatment just because of how many different species of Leishmaniasis there are. When it comes to cutaneous, you either do a systemic or a topical treatment, but for mucosal it has to be systemic, which is either oral or parenteral treatment. The only FDA approved drug for cutaneous and mucosal Leishmaniasis is miltefosine, which is actually only approved for certain species of the Leishmania protist that cause cutaneous and mucosal Leishmaniasis. When it comes to the visceral form, you absolutely have to get treatment just because it infects such important internal organs. And the only FDA-approved drug for this is the liposomal amphotericin B, which is a parenteral drug. The interesting thing, though, about these two FDA-approved drugs is that you can use them to treat the other form. So you can use miltefosine to treat visceral Leishmaniasis, or you can use liposomal amphotericin B to treat cutaneous or mucosal Leishmaniasis. It's just that it's not FDA approved. And when it comes to prevention, you either have to just have to wear long sleeves, avoid places where you can get bitten, use mosquito nets and insect spray, because there is actually no vaccine available as of yet. So here are my citations. And yes, here are my citations. Thank you for watching, and I'm happy to answer any questions that you have.